Good morning, everybody. I would like to welcome all of you on behalf of our Autism Child's Care. It is based on Dhaka city from Bangladesh. Today, we would like to discuss regarding OPT, oral placement therapy. We all knows that its use for feeding and speech relevant difficulties. Some children they have a speech problem, speech delay, and they have also to use muscles, oral muscles properly, as well as they have feeding issues. Some children they doesn't take special foods or texture, even they have difficulties to opening mouth and how they coordinate their muscles to speech, to create sound, to create different type of alphabet. So that's why we use actually OPT, oral placement therapy, where they have problem in sensory based, oral sensory based problem. So we can start. Firstly, we have to know what is oral placement therapy or what is OPT, oral placement therapy. Oral placement therapy is a tactile proprioceptive techniques actually that utilize auditory, visual, and tactile sensory stimulation to the mouth to improve their speech clarity, to differentiation of oral movement, lip movement, tongue movement, and also to improve their feeding skills. Oral placement therapy. We all know that oral issues. So, where do I need to put my lips, jaw, and tongue? This is very, very important three common parts. And these parts produce our sound, produce our speech, how we can move and how we can control our lips muscles, jaw muscles, and also tongue. It's how graded our jaw movement, how much graded to bite, to feed ourselves. This is oral issues. As you know, some alphabet they have to close our lips, and some alphabet when we spell or produce sound we need to open our lips. How much and how can move our tongue, where lateralization or upward or downward. So this is total feels its oral control movement. OPT specialist they works on oral control movement also, as long as feeding issues. How OPT helps your children? It helps to increase awareness of muscles or oral mechanism, number one. And number two, it helps in normalizing tactile sensory issues. Some children they have tactile hypersensitivity within their oral muscles, so it's reduced, it's normalized that tactile hypersensitivity. And some children they have hyposensitivity, so that's also increase their tactile sensory issues. It helps to improve their precise movement. I mean precise movement of oral structures to production of specific sounds. It increases the different oral movement, different tongue movement, tongue lateralization, tongue ups and down, lip closing. It also improves lip closing. In simple language, OPT actually used for speech clarity and feeding problem. It's used for autism, children with autism, cerebral palsy, even Down syndrome. They have some problem in muscles weakness. The how to speak or how to move their masticated muscle, chewing. This OPT is helpful for those disordered children. In Down syndrome, we all know that their tongue is protected tongue. So they face difficulties to retraction their tongue. So OPT also helps to reduce the protection and improve their retraction inside the tongue and movement, how they can move to produce speech and also feeding issues. Motor planning, it's very important issues. How do I get my lips, jaw and tongue in motor planning? It's the motor planning. It comes from our brain, and we have to make sure that planning is very necessary. Motor planning especially. Sensory awareness. We have to feel where is our jaw and how move it. Where is our lips and how moves I mean lateralization, right side or left side, tongue appropriately movement. So sensory awareness is very important. So in OPT, oral placement therapy, as a certified oral placement therapist, we also look for that. And thank you for watching our video. On behalf of Autism Child Care,